I'd just like to welcome you all to the UCD COVID-19 Research Seminar Series, which UCD Research has been hosting since last September. And the purpose of the seminar series is to showcase ongoing COVID-related research at UCD across our 6 colleges, and also to help facilitate greater interdisciplinary collaboration within UCD and also with external partners. And we're delighted today to have Professor Grace Mulcahy from the UCD School of Veterinary Medicine with us to talk with us today. So I'm just going to start by introducing Grace, and then I'll hand over to her and she will give a 15-minute presentation, and then we'll have time at the end for questions and comments. So Grace is a full professor of veterinary microbiology and parasitology. She spent almost 10 years as the Dean of Veterinary Medicine at UCD and also 6 years as the head of the school. She served 2 terms as a member of the Veterinary College of Ireland and also was a member of the American Association of Veterinary Medical Colleges Board of Directors for 2 years, and also spent 6 years as a board member of AFBI in Northern Ireland. Grace has an active research group focusing on One Health, helminth immunobiology, as well as vaccines for veterinary parasites. And she's also a member of the Royal Irish Academy. So we're delighted that Grace is here today to talk to us about the SFI-funded project, Understanding and Preventing Outbreaks of COVID-19 in Meat Processing Plants, which commenced at the start of this year in January. So I'm just going to hand over now to Grace, who will give a short presentation. And while Grace is speaking, feel free to pop questions and comments into the Q&A or the chat box, and we'll leave around 10 minutes at the end of the webinar to pose your questions and comments to Grace. So I will thank you all very much, and you're very welcome, and I'll hand over to Grace, and we'll then get started with the talk. Thank you very much.
Hi everyone, thanks very much for the introduction, Sinead. We had a bit of trouble with slide sharing, as I was explaining earlier to Sinead. So can I just ask if anyone can see slides as yet, or it hasn't started yet?
No, we can't see anything.
Oh, okay, that's fine. So we may have a little bit of trouble there. So while I'm starting to share here, what I will do is I will just start by saying that I'm very much feel as if I'm an interloper here in terms of presenting this work, because it's very much the work of a large team of interdisciplinary colleagues in UCD, and really it's they that should be getting the kudos and the I suppose value from presenting this work. I'm very much just a facilitator, so I want that to be said from the outset. So our project is called UPCAM, Understanding and Preventing Outbreaks of COVID-19 in Meat Processing Plants. And then it has the tagline, Prepared for the Future, as well. So that's the premise from which we started on. And I'm really still having trouble sharing my slides, so I'll just continue to talk. Okay. Oh, here we are. So, okay, let's have another go with this before we run out of the 15 minutes. It worked perfectly.
Yeah, no, it is coming up now. We can
okay, that's great.
We just need, the slideshow, hopefully. We did test it before and it worked, so this is always
How's that?
It's not quite the slideshow.
Okay, all right, let's worry about that. Here we go. Now, I think we have it now. Okay.
Yes, that's it. Thank you very much.
Okay. So as I said, this is very much an interdisciplinary effort. We have lots of different partners involved, from UCD, from other academic partners, from our partners within the meat industry and Food and Drink Ireland as well, and also internationally. So really, as I say, all I'm doing is facilitating a group of great scientists and academics. So what we have is phase 2 COVID-19 rapid response funding from Science Foundation Ireland, and we have the funding over 12 months. So as you'll imagine, the work is time critical. There isn't a lot of time to get started and get things done. And there are an additional 12 staff hires across the project. So we do feel a little bit under pressure. It's one of the larger rapid response awards made. So I think we are duty bound to show value for money and to show we're having an impact on control of the pandemic within Ireland. Key to the success of the project, I think, is rapid dissemination and application of our findings to industry. And so connection and communication with our industry partners within the industry, I think, is paramount as well. Grace Mulcahy and Shay Fanning are the co-PIs named on the proposal, but as I said, there are a large number of other participants as well, and I'm particularly grateful to Shay Fanning, my UCD colleague, as well for his fantastic support and co-work and co-lead of this project. So why did SFI fund this, and why did we look for funding in the first place? Well, meat processing plants, as we know, are essential workplaces and deemed so in the context of the pandemic. And history has also shown over the past 18 months or so that they are sites which are vulnerable to transmission of SARS-CoV-2. For example, in the USA, there were 19 outbreaks in meat plants, or 19 states had outbreaks in meat plants rather by May 2020. And perhaps one that had the most media attention in Ireland and in Europe was an outbreak in Germany in the Tönnies plant in Gütersloh, where 1,400 out of just over 6,000 employees were infected within a short period of time. And in Ireland, at the time we were writing the proposal, in mid-2020, there were outbreaks, or had been outbreaks in 22 meat processing plants, and with over 1,000 workers positive by PCR. And of course, we all know the story about the lockdown in Kildare, Laois and Offaly at one point, which was not directly, but perhaps indirectly linked to the fact that there were some plants and meat plants in those areas. So before receiving the funding, with colleagues in the Department of Agriculture, we have been involved in a pilot study, a retrospective study of outbreak in a plant. And we had made a start on this rapid response application. And my colleague Donald Salmon in DAFM, who very much is one of the driving forces behind this project as well, was involved in a validation exercise of rapid antigen testing in meat plants in collaboration with the HSE. And as you will see, there very much is a continuing line from both those pilot studies and the rapid antigen testing exercise, and as we began work on UpCom. So our project has 9 work packages overall, which all have to fit together. And I'm just going to talk about a few of them here. I'm going to talk about work package 1, which is about testing, 2, which is about risk assessment of operational factors, 3, monitoring and assessment of environmental factors I'll take with work package 2, and then just a little bit about the 3 other highlighted work packages here. I think some of the other aspects here, the work packages which are not highlighted, I'll just briefly mention as well. So work package 4 is led by Vim Mayer, again at UCD, and Vim's work, of course, has received national and indeed international recognition for his work in using wastewater monitoring as an early warning system for transmission of the presence of the virus nucleic acid. And what Vim is doing with his colleagues in this project is applying that, or investigating if it can be applied to individual plants as a surveillance and monitoring system. Survival of the virus on biotic and abiotic surfaces then is something that is of concern internationally, particularly from trade point of view, as well as from public health perspectives. And this is something that my colleagues Gerald Barry and Tristan Russell and Nicola Fletcher are doing as part of the project, but it is also paralleled by a project led by Shay Fanning and Maria McCurry as well, on exactly the same topic, which is funded by WHO. And so again, we can give details of that at another time. And finally, work package 7, validation of alternative environments for meat packing. The reasons for that will become clear when we go through the data about the risk factors and monitoring of same. So just to start off with testing and antigen testing. So what I mentioned was that at the end of last year, at the beginning of this year, the HSE, together with the Department of Agriculture, Food and Marine, who has statutory responsibility for oversight of meat processing plants, carried out a validation exercise where they did parallel testing of work plants in conjunction with the monthly or more frequent PCR mass testing that was going on at that time in the plants. And what they did was, from every person that was from whom a nasopharyngeal swab was taken for PCR, they also took a self swab just from the anterior nares and tested it using an Abbott PanBio COVID-19 antigen test, as you can see here. So there are a number of differences between this, of course, and the PCR test, one of which is that the sampling required for the antigen test is much less invasive than that used for the PCR. It can be taken by an individual themselves. And the second is that the result is available much more quickly within 15 minutes after the test has been taken. Another difference, of course, is that the antigen test detects nucleocapsid protein, whereas the PCR test obviously has a very big amplification test and amplification step and detects PCR or detects nucleic acid. And so this is much more sensitive. So fully we were expecting, or DAFM were expecting, the antigen test to be less sensitive than PCR in the validation exercise, as indeed proved to be the case. So these are the summary results of that exercise here. And so over 5,000 workers took part in the validation exercise. And of those, 41 were PCR positive and positive also by the antigen test. So the two tests agreed in that respect. And 38 were positive by PCR, but negative on the antigen test. So the two tests did not agree in that case. We also had 2 individuals who were negative by PCR and positive on antigen test. And of course, then over 5,000 individuals were negative on both tests. And if you analyze those results in a bit more detail, there's a number of things you can see. First is that 41 individuals within the sampled population, meat plant workers, would have been removed from the workforce very rapidly if rapid antigen tests were in daily use, if you like, or in weekly use in meat plants, which otherwise would not have been picked up other than by monthly PCR testing. So these are by definition asymptomatic individuals. They wouldn't be at work otherwise. So although the sensitivity is much less, what you have the capability of doing with the antigen test is picking up these workers that otherwise would go undetected. So quite simply, the sensitivity of the PCR, as expected, is much higher. However, there is a gradient. So the sensitivity of the rapid antigen test is higher when more virus is present, when the viral load is greater. So this test is better at picking up individuals more likely to be infectious and capable of transmitting the virus than those individuals who perhaps just have trace amounts of virus nucleic acid present. So of these 38 individuals who were negative on antigen tests but positive on the PCR, 28 of those 38 had a CT value on the PCR test of greater than or equal to 27. And the CT value essentially just tells you how much amplification you need to do before you have a positive result in your PCR. And I think this CT value of 27 is a reasonable proxy for a viral load, which is non-infectious versus infectious. So we were reasonably confident then that this antigen test was doing okay at detecting these potentially infectious asymptomatic individuals. So a little bit more analysis then shows this CT value of less than 25, the sensitivity of the antigen test as compared with the PCR above 80%, and so on, and going down to just over 50% at a CT value above 35 or less than 35, and which is about the limit of detection of the PCR. And equally then we saw a different range of mean CT values detected by the 2 antigen tests. So the end result of all of that has been that the HSE and the Department of Health have agreed that rapid antigen tests of exactly the same kind that were used in the validation exercise could be rolled out to food business operators, including meat plants, under the aegis of the Department of Agriculture, Food and Marine, with weekly reporting back on how many tests were done and what the outcome was. And of course, anybody detected as positive by an antigen test would be sent immediately for a confirmatory PCR as well. So one added bonus that has appeared from this is that with Shea and Garino in their lab, they have discovered that actually it is possible to obtain full genome sequence from spent lateral flow devices which were positive. So this again allows us and allows Shea and Garino in particular to contribute to the molecular epidemiology of how the virus spreads within a plant, and also to look for things like variants of concern and so on, and contribute to the national epidemiological picture as well. And so again, this is something that we're very interested in pursuing and are already investigating what variants are present, for example, in plants in current outbreaks. Now, we have some lessons that we learned from the rollout of the rapid antigen test, which I think are very relevant to the situation today. And the first is that the uptake of the antigen testing across this sector has been slower than anticipated. So absolutely heroic efforts went in to get the rollout accepted by the public authorities and getting sanctioned to provide these antigen tests to the plants. And it's a little bit disappointing to find out now that this uptake has been quite slow. You know, in the project, in the Upcom project, what we've been doing is we've been providing a lot of training to the meat plants and how the test can be used. We've run webinars from them, and we've told them exactly how to use the test. We've worked out what a positive test means and doesn't mean. So caution, again, just because you're clear on the antigen test doesn't mean you don't potentially have the virus and so on, and how they can be used as risk mitigation. So I think what we've concluded and what we're continuing to work on is that as antigen testing begins to be rolled out to other sectors of society, and you will have seen that Minister Harris has signalled that it is likely and he would like antigen testing to be rolled out across higher education, communication and consideration of the sustainability of the venture are paramount. And so very, very careful communication and encouraging uptake and encouraging people to stick with the efforts of antigen testing, I think, are really important. So we're continuing to work on that within the meat industry sector, and I think you'll see efforts in wider sectors of society on that as well. So I think one of the things that we can say is that this work has been valuable, and it is relevant not only to the sector within which we're working, but also to other settings where antigen testing may be deployed. Okay, to move just very quickly now into the operational risk assessment. So as I said, one of the things we did before the funding was even granted was to conduct a pilot study of the operational and environmental risk factors retrospectively that may have facilitated an outbreak and transmission in meat processing plants. So I won't go into details here. We assumed that super spreading events were likely and that aerosol transmission was likely to occur. And we wanted to see what were the factors that affected that within a plant. And so this work here on the environmental parameters was done by our colleagues and collaborators in UCC, Stig Hellebust, John Benger and colleagues. And they went in with their measuring material, and they measured things like not only environmental temperature, but ventilation rates, and particulates in the atmosphere and CO2 levels in the atmosphere in various departments of a meat plant. So a typical primary processing meat plant will have many different rooms and many different compartments, ranging from the lairage, which is where live animals to come in, the slaughter area, the boning hall, the dressing line, and then areas such as canteens, packaging areas, administration areas, offices, and so forth. And I think I've put up this graphic here to illustrate the fact that in the outbreak that was investigated, or an outbreak that was investigated, one area that appeared particularly at high risk was the boning hall, which is where a carcass would be dissected, if you like, and the various cuts of meat removed. And 54% of cases in an outbreak we investigated took place actually in the boning hall. So this was identified objectively as a very high risk area. And if you look at the temperature difference between the boning hall and the dressing line, a control area, if you like, for food safety reasons, the boning hall is required to be kept at about 12 degrees centigrade. It was 10 degrees in this case, whereas much higher temperatures operated in the rest of the plants. So clearly this could be a risk factor for survival and transmission of the virus. Ventilation was another one. So we all now know that airborne transmission is a very big factor in COVID-19, and quite simply, recirculation of cold air in boning halls is definitely, we think, a risk factor now. And of course, the risk of that within summer is greater than within the winter, because you're having to do more recirculation of air to keep the air at the required temperature. So that is something I think we need to be watching out for in the summer. Also within particulates, there was an upward trend of particles in the atmosphere in the boning hole, not much difference on the dressing line during the day, and quite clearly CO2 levels were trending upward during the day in the boning hole and not elsewhere, for example, on the dressing line. So that is an indication of the level of activity, if you like. The boning hole also has a lot of fairly physical work. It's very difficult to maintain social distancing. So that analysis, I think, was a useful part of that ongoing assessment of risk factors. And so then the other thing we're doing in terms of this work package is just producing, if you like, plans, and we're disseminating to the industry the different risk assessments that we've done, and again informing them about the risk mitigation measures. I have to say that the managements of the factories in most cases are very well aware of these factors and are very much on the ball and ahead of the game sometimes in terms of the precautions that we're taking. What we'd like to do is just enhance their existing very good response. And they all have emergency response teams, they're all doing really well. And I think what we want to do is try and enhance that by producing the science behind it and using antigen tests and so on. So the ongoing work we're doing in this area includes what we call our long pin survey of a large number of plants. We also have some in-depth case studies we're working on. And then our colleagues in the Insight Centre at DCU, Andrew McCarran and colleagues, are working on integrating the data from this and other work packages into producing, which we think will be some really exciting information as well. So I mentioned data integration. This is an important work package. As we know, this CSO is making a large amount of relevant data available through the HRB and other sources. There are a lot of strings, of course, attached to this data, as there should be. And our colleagues at Insight and DCU have a nice website for the project, which they have set up and we've all inputted into. And there is a nice repository of data sets on there now, which people can consult. And our colleagues then are currently looking at the application of machine learning to help predict outbreaks in meat plants and looking at the use of SEIR models to understand transmission rates as well. We also have put up there our training materials and our FAQs on use of rapid antigen tests and so on. So that's just a very quick flavour of some of the work we're currently engaged in. But of course, I think, we are all kept up at night by wondering, are we going to show the value of the investment that's been made and what impact can we say we've had on the situation? So when our grandchildren come and ask us, what did you do in the pandemic, Granny? And maybe these are some of the things which we can say. I think currently we can say that our group and our team have really made a contribution to understanding the relative risks of within-plant transmission. I think the team have produced enhancements to risk mitigation and managed to reduce risks in certain settings. And as with the rapid antigen tests, I think we will continue to show what we've learned to help people deploy those antigen tests and other risk mitigation measures properly in other settings as well. I think to an extent, we can say that we've had an influence on policy in that setting. So, we've told, for example, Mark Ferguson's group, who is looking at whether or not antigen tests should be deployed more widely, of our experience. So that's nice to see again. We also have some nice international collaborations. So we have on our team as collaborators the Tönnies plant in Germany, which had a very big outbreak, and academics from Technical University Braunschweig and Melanie Brinkman there, and who have helped us with their experience, and we're collaborating with them. Also, there are a large number of protocols developed in the project which will be freely available, and whether it be for sequencing or for other aspects, which I think also represents a contribution. And at this stage, we can say we have 2 manuscripts in preparation, one on sequencing and testing, and one on the operational risk factors. And certainly we hope that there will be many more as well. So what will we do in the future? Well, I think that we can say that we hope to have something good to say or something valuable to say about variance and seasonality and risk within meat plants, as well as molecular tracking within plants through looking at sequence variation and so on. Certainly, I think our colleagues will have a lot of good things to come out of the data integration and modelling package. And of course, we know that this is unlikely to be the last major pandemic we face, and hopefully if we are faced with a similar threat in the future, and indeed if COVID hangs on or goes away and comes back, we think we will be in a better position to withstand future threats. Scientific dissemination through publications and also industry dissemination we think has been valuable. And lastly, I think undoubtedly we will all be involved in reflections as a country and as a community, as well as internationally, on how we did in terms of managing the pandemic. So I imagine our pandemic reflections are going to go on for some time, and we will all be thinking, you know, important things about how our society is organised. And I think we will have hopefully something to contribute to that as well. So again, finally, again, just to emphasise that all I'm doing really is facilitating really great groups of people along multiple disciplines and institutions. I've listed here the groups contributing from UCD, UCC, Department of Agriculture, Food and Marine, DCU, also TU Dublin, RCSI, Tönnies in Germany, and TU Braunschweig. I'm sure I've left some people off there. 1,000 apologies if I have. It wasn't intentional. It's just that there are a lot of you, and it's been great working with you. And we'll continue to do our very best to get something good to come out of this project. Thanks.
Thank you very much, Grace, for that fantastic presentation. What is a really exciting and important piece of research, and great to see such a wide range of collaborators, both nationally and internationally. We just have a few minutes left for questions and comments, and we've had a question that's come in around the rapid antigen testing. Just wondering, does this test pick up on all the different variants of COVID-19?
As far as I'm aware, it does. I've not heard anything to the contrary. A lot of the mutations, of course, in the variants are within the spike protein, which is the bit that attaches onto the host cell. And the antigen test that we're using targets the nucleocapsid protein, which is a less variable, I suppose, part of the virus. So as far as I'm aware, yes, but I stand to be corrected on that.
Okay, and I know there was a lot of media coverage last year around meat processing plants and, you know, the spread of COVID. And there was a lot of talk about migrant workers and their potential role in the spread of the virus. What have your preliminary findings shown on that? You know, has that affected the spread of COVID in those settings because there are maybe more migrant workers?
Well, I think one thing we can say is that the plant management have been very quick to realise that they need to engage all of the different language communities, for example, they have within the plant. So, for example, if we're providing information leaflets or consent forms for rapid testing, they would have to be disseminated in all of the different languages. And equally, I think what we've realised is that in terms of the acceptability and communication piece, it's really important that there are champions, if you like, or leaders within all of the different communities in a plant that will be able to talk to their communities and to ensure that, you know, there is good communication and nothing is being hidden here and so on. I think the larger question, which I think you're asking there about, you know, migrant workers and whether that contributes, is really a bigger societal question. And I would say that, you know, that's part of the conversation that we'll all be having as a society after this pandemic. I meant to say at the end there that, of course, from a School of Veterinary Medicine, I very much espouse the One Health paradigm, which of course means that, as you know, Sinead, health of animals, humans, and the planet is all interconnected. And so, you know, we all also have to take into consideration our food systems, our ecosystem stability, and so on, and how we value people. What is an essential worker? How we value shop workers, people who work in food production, all of that. And I think there are a lot of questions to be answered there. I don't think our project can answer those questions, but I think we can be part of that conversation in the future.
Fantastic. We're just after 2:30, but there have been a few more questions that have come in, so I might try and quickly answer one more. Have you observed any difference in cases between beef plants and pork plants in terms of social distancing and how the carcasses are, you know, kind of managed? Have there been any differences, or has your study looked into that?
That's a very interesting question, Conor, and I think occupational health professionals have been involved in our pilot study and so on. I think our impression so far is that the boning hole in beef plants can be a high risk area. Certainly, I think there have been some outbreaks, and pork plants can also be an issue. I think realistically, I think in any boning hole, with the way people are working and carcasses moving along and so on, it is really hard to maintain adequate social distancing. But I think probably what we're realizing now, that even with the 2-meter social distancing, that isn't enough of a barrier, if you like, to prevent transmission, because the gutter slough outbreak demonstrated, for example, transmission over 8 meters and so on. We've also looked at some poultry plants. So I don't know that it's as simple as, pork carcasses are smaller and, people are closer together. I think it's a bit more complex than that. But it's a very interesting observation, I would say.
Absolutely. Okay, final question very quickly. Is there any study on the use of temperature checks? I'm not sure if that relates to the temperature of the different areas or people's temperature checks. I'm not sure.
Yeah, well, very interesting question. Temperature checks, I think, were in use in a lot of plants. And now I think they've probably been supplanted by people being asked to do rapid antigen tests before they go into the plant. And we haven't conducted any work on temperature checks, but I've heard that people have not found them to be very effective in preventing infection to come in at one time. Temperature checks, as I said, the low temperature in the boning hole does seem to represent a risk factor. And what we would like to do in one of our work packages is to see if we could maintain food safety requirements and low temperature in the food being produced, while still allowing the ambient temperature to go up a bit. So that's the topic of another work package.
Very interesting. Well, listen, thank you so much for your time and for sharing your preliminary kind of findings and insights on the study. Upcom, it's been really interesting. I've learned a lot. And thank you very much again, Grace, for your time. And thank you very much to everyone for attending and for your questions and comments. We very much appreciate it. We hope you enjoyed the talk. And the recording will be available on the UCD Research website afterwards. So thank you very much again, everyone, for your time, and enjoy the sunny afternoon. Thank you very much.
Thank you.
Have a good afternoon. Thank you, Grace.
Bye.
Bye.